My name's Hans Selvag. I'm a PhD in social work, a licensed clinical social work. I have a clinical practice and a forensic practice. I use IBP with my clinical clients. I see adults mostly and teenagers. And in my forensic practice, I use it because in how I am connected and present and grounded within myself, and working with people who are underprivileged, people who are facing severe criminal penalties. I specialize in death penalty cases and murder cases, and I get hired by defense attorneys to help them understand their clients, to help assess what the issues are, what the traumas were, what the story is that they experienced that led them to this place in their life where they have committed a serious and egregious crime. And for me, IBP is just a regular part of my everyday experience, and keeping me connected to my aliveness, keeping me connected to health, and keeping me connected to my creativity, that I can bring all those three things and all the wisdom of the body, being free from interruption of some negative thoughts or negative patterns I may have had from the past, and to really flourish as a professional and as a human being in the work I do and in my personal relationships as well.
My name's Deena Halstead. I'm an IBP therapist, marriage and family therapist, and I'm also a teacher. I use IBP every minute of my life. I live by the tenets of what I've learned here. It's transformed my life. And I use IBP in my practice with my clients, and in my family with my children, and with basically anybody I come into contact with. When I first came to IBP, I was my own worst enemy. Now I'm my own best friend. And with all the clients I see, couples or individuals, they come in with definable, well, through IBP, definable issues that doesn't take much to turn them around and create a transformation in the body and in the mind and in the soul, to know their own well-being and to live life out from a better place, a more authentic place. It works. It's simple and it works. People walk this earth interrupting their well-being. And IBP helps people understand how they're interrupting it and how to change that up so that they can be more authentic and be more in touch with their joy.
I'm Noah Rothschild, and I'm a licensed psychotherapist in Santa Monica, California. How I use IBP in my work is, for about 8 years, I was the head family therapist at a place called Passages in Malibu. And so a lot of my work specializes in bringing IBP to those in recovery and people recovering from addiction and also trauma as well. And so I use IBP in a way by helping them go back developmentally and heal places that 12-step meetings don't heal, or sitting in a group don't heal. We go back, we reawaken the body. I teach my clients tools to get alive and feel a natural high that comes from their core inside. And then I also help them go back and reparent themselves and give themselves what they didn't get growing up. And from that place, they start to become more empowered. They start to set boundaries. They start to show up in their life in a way that creates meaningful changes and creates a lasting transformation.
My name is Carol Polavoy. I'm a psychotherapist and a certified biofeedback specialist, stress management and wellness coach. And I have a private practice in Agora Hills and Westlake Village in California. What brought me to IBP was about 20 years ago when I had some major health issues. I had fibromyalgia and chronic fatigue severely. And I knew that there was some kind of an emotional component. I just knew that intuitively. And I was looking for a mind and body therapy. And I actually looked on the internet and found IBP and made the phone call, and from that point on, my whole life changed. I got into the program, became a practitioner, and then trained as a teacher, and it was the foundation for my psychotherapy that I use now. And as of today, because of the tools that I had with IBP, I no longer deal with the fibromyalgia and chronic fatigue, so I'm happy to say that. So because of my journey, I actually work with individuals, and I work in the corporate world, teaching, doing groups, teaching people mental health tools and stress management so they can live happier and healthier, balanced lives, and that they're more productive. And for me personally, because of IBP, I live a more fulfilling life. I do not have the illnesses I did. And what IBP has taught me is how to stay grounded, how to stay in my body so that I can actually be present and actually show up in the world.
My name is David Lindquist. I'm a marriage, family, and child therapist. And I was a teacher, a school principal, and a trainer of teachers for 20 years. And when I decided to change my career, I felt like I really wanted to have a good, strong base note of a theory to work with. And of all the theories I studied in the beginning, I chose IBP, that there would be the theory that would be my main course. And it has really panned out well. And I'd say I still specialize in children and adolescents, and I can tailor a lot of the exercises and so forth to children with anxiety. A most valuable part of IBP is what I've been learned about family systems and how families operate. And that part has been absolutely invaluable to me. In a therapy session, I always know where to go. I always know what's going on. I might not do the right thing exactly, but I know what's going on and I know kind of where to go. And I think it's done that for me in my life as well, that any personal problem I have, any emotional issue I have, I can deal with it and work with it through the IBP process. And it's shown me over the last 20 years that this process really works. The theory really works well, both personally, interpersonally in my life, and professionally. They integrate both profoundly.
Deena Goodman. I'm a physical therapist in West Los Angeles. I specialize in treating pelvic health, so urologic conditions, gynecological trauma, pelvic pain in general. So I came to IBP from my father, who is an attorney who found an IBP practitioner, Beverly Catane Morris and Jack Rosenberg, for personal health and growth. And through that, I found a body, literally a new body with IBP, and I cannot not integrate the mind-body aspect in the body work that I do. I am now a teaching assistant in the IBP program, and I incorporate the tools and practices that have to do with body in my private practice in West LA. IBP has helped me to acknowledge that I don't have to live my life out of fear, that I can feel the attunement, the connection to self, and the awareness of calmness in my body so that I can think and make choices that are true and authentic and not fear-based. IBP helps me in my work in dealing with many patients that have chronic health conditions, who are in a lot of pain and come in with overwhelming stories, both to themselves and their presentation, so that I can actually help them unwind their systems, both neurophysiologically and cardiovascularly, and help them expand in different ways. If I did not have IBP, I probably would not be able to have that constancy and that calmness to be able to energetically help them in their process physically.
Hi, I'm Dr. Margie Yale, and I'm a psychologist licensed in California, and I'm also a counselor right across Canada. And right now I'm running and directing an institute for training in integrative body psychotherapy in Saskatchewan, in Saskatoon. And IBP has been wonderful for me personally as well as professionally in many different ways. It's informed the way I live my life. It has definitely benefited me from a health perspective. And as I take it into my career as a counselor psychologist, I find that I make big transformations happen for people because of my knowledge and my experience, and because of the fact that I've done my own personal work. So it's been very effective. I use IBP with my patients the way that I use IBP with myself. And that is that I have them start to connect inside so that they can see the interruptions that come in that are thematic and patterned, and that can be released with simple breathing and movement releases and tools that we use in the Integrative Body Psychotherapy practice.